Well, welcome back. Today, we are taking a closer look at the crisis Black and brown mothers in America are facing. Now, it's a crisis pushed back into the spotlight after two viral videos gained national attention. Take a look at your screen. One shows Kari Jones pleading for help as staff delayed her care, and she delivered just minutes after being taken to a room. The other video shows Mercedes Wells, who was sent home from the hospital while in labor, only to give birth 8 minutes later in a car. Now, these stories highlight the disparities Black and brown women face in maternal health. And joining me this morning is Ladrea Williams-Briggs, who is the founder of NotUsSC, an organization dedicated to improving maternal health outcomes through culturally relevant education for Black women. And she's here to break all of this down. Thank you so much for joining us this morning. And first up, we've all seen these viral videos. From your standpoint, when you first saw those two videos, what was going through your head?
Absolutely. Well, thank you so much for having me this morning. This is such an important conversation, and this act of advocacy and having these talks is so important. Those videos were heartbreaking, absolutely devastating, but unfortunately not shocking. This is a lot of Black women's story, myself included. We often are unheard, our pain goes unnoticed, and we often face a lot of challenges in pregnancy and childbirth.
And when you look at what happened to those two women, what stands out to you as the biggest failure in healthcare?
Well, just not listening to Black women, not taking our concerns seriously, not believing us when we say that something is wrong. And it really showcases the gaps in the system and in the healthcare systems that we currently have.
And are these isolated incidents, or do they reflect on a larger pattern you're seeing among Black women?
Absolutely not. Absolutely not. So the U.S. actually ranks highest for maternal deaths amongst all developed nations. South Carolina specifically ranks 8th highest in the U.S. for maternal death. And in our state, Black women are 4 times more likely to die from pregnancy-related causes than their white counterparts. So unfortunately, this is not unusual. And it really points to a desperate need for action.
Absolutely, absolutely. And from your work with NotUsSC, what's one of the most common signs that a mother's pain or symptoms are being dismissed?
Well, what we saw in those videos, women are often sent away. I was told when I experienced my own maternal health emergency 3 years ago that there was nothing outside of the normal that was occurring. We often hear women saying, oh, you don't know what you're experiencing, you don't know what's happening, and they are not treated as the experts in their own care.
Yeah, and in that video that we saw, the nurse
Yes.
that the pregnant woman was speaking with,
Yes.
she was eventually terminated.
She was.
Do you think termination is enough when it comes to situations like this? Or what do you want? What would you think should happen?
Absolutely not. So termination's a start, right? But that was that nurse. The problem is that nurse exists in so many other settings outside of that isolated incident. We need policies. We need backing to help Black women be believed. We need advocacy. We need to empower our communities to know that when something's wrong, they need to be heard and they deserve to get the care that they need.
And in both of those videos, each one of those mothers, they had someone there to
Absolutely.
record these incidents. For folks, or for a woman right now who may be watching this, a Black or brown woman that may be watching this, what do you say about having someone with you, an advocacy,
Yes.
as you will? How important is that to have with you during labor?
Absolutely, absolutely. Social support is so important. Have someone there that knows you, that can speak for you in those moments where you're unable to speak for yourself. Have a partner, a friend, a doula. There are so many programs out there that are able to help Black and brown women access doulas, and they do incredible work in that advocacy space. But also, don't be afraid to advocate for yourself. You know your body. You know when something's not right. Even if you've never had a baby before, you've lived in this body, you've learned this body, and when you feel that something is not right, stand up for yourself and make sure that you're heard.
And I want to talk about how important culturally relevant education,
Yes.
like NotUsSC, how does it help with women and advocating for themselves?
Absolutely. So one of the things that we focus on at NotUsSC is taking the education to the people instead of waiting on the people to come to the education. So we put our materials in beauty supply shops, places where Black women frequent. We have an initiative coming up in the spring called the Crowned and Care Initiative, where we're training the beauticians and the hair braiders on how to teach women to advocate for themselves and stand up for themselves. So it's important that we speak to people in language that they understand and in places that they frequent and already trust.
And when you see stories like this, How does it impact Black and brown women's thoughts process or their trust in our healthcare system here in the U.S.?
Yeah, so we know that historically there is a lack of trust in healthcare for Black people overall, not just Black women, but we don't really buy into what the doctors are saying. And so it's important that when we're getting this health education, that it speaks to us in languages that we understand from people that look like us. Yeah.
Absolutely. And for women who live through experiences like this, what kind of support do they need afterwards? And I specifically wanted to ask you this because you told me that you went through something like this. And if you don't mind sharing, we'd love to hear your story as well.
Absolutely. So unfortunately, I do have my own sort of no one listened to me story. 3 years ago when I had my daughter, I experienced HELLP syndrome. It's a rare but life-threatening condition that can lead to organ failure. I was in the hospital, I was in pain, I knew that something wasn't right, and I stood up for myself and I said, I'm not going home like this. I don't know where we're gonna go, I don't know if we're gonna bring in another doctor, but I'm not going home. And so in that experience, after that, I wanna make sure that people know that pregnancy-related postpartum or post-traumatic stress disorder is very real. Therapy is available. There are counselors available. There are people that you can talk to. In South Carolina, I'll tell you that most pregnancy-related deaths happen in the postpartum period. So from day 1 to day 365 after that baby is born is when mom is most at risk. So making sure that you have those support systems in place that can look at you and say, something's not right, we need to do something, and that they are able to take action and you are as well.
And so that's also something that mothers need to be aware of, not only during birth, but afterwards. What are some of the if you know, some of the things that mothers die from after birth?
So a lot of these conditions are related to cardiovascular issues, hemorrhage, infections. So just being aware of the postpartum warning signs, headache, nausea and vomiting, swelling. You can go on our website to learn more about those. Also, the local health department has a lot of resources around that. Making sure that if these things are occurring and you just had a baby within the last year, that you immediately seek help.
Absolutely. And I want to ask or get more details about NotUsSC.
Yes.
Tell us about the organization and how folks can get involved or if they need help and things like that.
Absolutely. So hashtag NotUsSC, not me, not her, not us anymore. We create and distribute culturally relevant maternal health education materials to Black women, their support networks, and the community because no one should die giving life. It's not a normal, natural thing that happens. We should live and thrive beyond that. You can check us out on social media, on Instagram, Threads, and Facebook. And then always you can go to NotUsSC.org. You can donate to our Zephy fundraiser to help us print and distribute these materials in those spaces where Black folks are. And look for us around.
Absolutely. And I love the fact that you guys put some of those posters in the beauty shops because we know women love their hair.
We're going to look good, okay? We're going to look good.
Absolutely. Well, thank you so much for joining me. I really appreciate it. And if you want to watch this interview in its entirety, we're going to post it on our website. We'll be right back.